What if the greatest threat to your health is not pain, not weakness, not even fatigue, but silence? Imagine something happening inside your body right now, without alarms, without warnings, without dramatic signals demanding your attention. Chronic kidney disease often begins this way, quietly and patiently, progressing in the background while life continues as usual. You wake up, go to work, laugh with friends, plan for the future, and all the while your kidneys may be struggling without your knowledge. This is not meant to create fear, but awareness. Because awareness is the first step toward protection, and protection begins with understanding what is happening beneath the surface of your daily routine. The kidneys are extraordinary organs. Every single day, they filter waste, balance fluids, regulate blood pressure, and maintain the delicate chemistry that keeps your body stable. They work tirelessly without applause or recognition. Yet when chronic kidney disease develops, their ability to perform these essential tasks gradually declines. The most dangerous part is not the complexity of the disease, but its quiet nature. In early stages, there are often no dramatic symptoms. No sharp pain. No obvious crisis. You may feel completely normal, while subtle damage slowly accumulates. That is why so many individuals discover the condition only after significant harm has already been done. Understanding this reality changes everything. When you realize that something so serious can develop silently, you begin to see the importance of routine testing, regular checkups, and informed decisions. Blood and urine tests may seem simple, even ordinary, but they hold powerful information about your kidney function. They reveal what cannot be felt. They expose what cannot be seen. Many people postpone these tests because they feel fine, believing that absence of discomfort equals absence of disease. But the truth is that silence does not mean safety. Silence can sometimes mean progression. There is a deeper lesson hidden within this condition. Chronic kidney disease teaches us about the consequences of neglecting small signals in life. It reminds us that prevention is always more powerful than repair. When experts such as Dr. Matthew R. Weir emphasize early detection, the message is not merely clinical, it is profoundly human. It is about preserving quality of life, protecting independence, and maintaining the strength to pursue dreams without limitation. Early awareness allows for lifestyle adjustments, improved nutrition, controlled blood pressure, and medical monitoring that can dramatically slow progression. It transforms a potential crisis into a manageable challenge. Yet many people remain unaware of their risk factors. Conditions like high blood pressure and diabetes increase vulnerability to kidney damage. Family history can also play a role. But because daily life is busy and responsibilities feel urgent, long-term health can quietly move to the bottom of the priority list. We promise ourselves that we will schedule that appointment later, that we will start eating better next month, that we will take our symptoms seriously when they become more obvious. Unfortunately, with chronic kidney disease, waiting for obvious symptoms may mean waiting too long. This is not a message of doom. It is a call to mindfulness. Your body is not your enemy. It is your lifelong companion. When you choose to learn about kidney health, you choose empowerment over ignorance. You choose proactive care over reactive treatment. You acknowledge that strength is not only measured by endurance during crisis, but by wisdom before crisis begins. The quiet progression of chronic kidney disease challenges us to respect the unseen processes that sustain our lives. It encourages responsibility, discipline, and gratitude for the organs that serve us faithfully every moment. And once you truly understand how silently this condition can develop, you can never again ignore the power of early awareness. Have you ever considered that the most dangerous threats to your health may arrive without noise, without pain, and without warning? Chronic kidney disease often begins as a whisper inside the body, so quiet that most people never notice it until the damage has already progressed. You continue living your life, managing responsibilities, building dreams, and making plans, while your kidneys work silently in the background. These remarkable organs filter toxins, regulate blood pressure, balance fluids, and maintain essential minerals every single day. They do this faithfully, without demanding recognition. Yet when their function begins to decline, the body does not always send dramatic signals. There is no immediate alarm, no sudden collapse. Instead, there is a gradual shift, almost invisible, that slowly alters your internal balance. This is why understanding chronic kidney disease is not merely a medical lesson, but a lesson in awareness, responsibility, and foresight. Many people assume that serious illness must always feel serious. They believe that if something were truly wrong, the body would clearly announce it. Unfortunately, chronic kidney disease challenges that assumption. In its early stages, symptoms can be so mild that they are easily dismissed. Slight fatigue may be blamed on stress. Minor swelling might be attributed to diet or long work hours. Changes in urination can be ignored or misunderstood. Because these signs do not seem urgent, testing is postponed and medical advice is delayed. Meanwhile, inside the body, the kidneys may be filtering less efficiently with each passing month. The tragedy is not that help is unavailable, but that the silence of the disease convinces people that help is unnecessary. Routine blood and urine tests have the power to reveal what cannot be felt. They measure kidney function, detect protein leakage, and identify imbalances before symptoms become severe. Yet many individuals skip these tests simply because they feel normal. This false sense of security becomes the greatest risk. When healthcare professionals, including Dr. Matthew R. Weir, emphasize early detection, they are not speaking from fear, but from experience. They understand that time is one of the most valuable factors in protecting kidney health. When chronic kidney disease is identified early, lifestyle adjustments such as controlling blood pressure, managing blood sugar, improving nutrition, and staying physically active can significantly slow its progression. Early knowledge creates options. Late discovery limits them. There is also a deeper truth hidden within this condition. Chronic kidney disease reflects how easily human beings overlook gradual change. We tend to respond quickly to crisis, but slowly to quiet warning signs. We wait for discomfort to motivate action. We prioritize urgent tasks over preventive care. Yet prevention is often the most powerful form of strength. Taking responsibility for regular checkups, understanding personal risk factors, and educating yourself about kidney health are not acts of fear. They are acts of wisdom. High blood pressure, diabetes, family history, and certain medications can increase vulnerability to kidney damage. Knowing this allows you to act deliberately rather than react desperately. The silence of chronic kidney disease should not frighten you. It should awaken you. It should inspire you to respect the unseen processes that sustain your life every day. Your kidneys support you without complaint, filtering your blood thousands of times each day so you can think clearly, move freely, and live fully. When you choose awareness, you choose partnership with your own body. You choose to listen, even when there is no noise. And in that decision lies the power to protect your future before silence turns into consequence. There is a quiet truth about health that many people do not realize until it is almost too late, and that truth is that damage does not always announce itself. Chronic kidney disease moves gradually, almost respectfully, as if it does not wish to disturb your routine. You continue to wake up each morning believing that strength is measured by how much you can accomplish in a day, unaware that real strength may also depend on organs you never see and rarely think about. Your kidneys are constantly filtering waste from your blood, regulating electrolytes, balancing fluids, and helping control blood pressure. They perform these tasks every hour of every day without applause. Yet when their efficiency begins to decline, the early signs are so subtle that they blend into normal life. A little tiredness, a small change in appetite, slight swelling in the ankles, or more frequent nighttime urination can easily be dismissed. This is how silence becomes dangerous, not because it is loud, but because it is ignored. The most challenging aspect of chronic kidney disease is not only its medical complexity, but its psychological deception. Human nature tends to respond to urgency. We act when there is pain, when there is fear, when something interrupts our routine. But CKD often waits patiently in the background, allowing you to feel stable while microscopic changes occur inside your bloodstream. Over time, Toxins that should be filtered efficiently begin to accumulate. The balance of minerals shifts. Blood pressure may rise. Yet without testing, you may never connect these changes to your kidneys. That is why routine medical evaluations are not optional luxuries, but essential tools of prevention. A simple blood test measuring creatinine levels or a urine test detecting protein can reveal early dysfunction long before symptoms become overwhelming. This is where education becomes empowerment. When medical experts such as Dr. Matthew R. Weir speak about early detection, they are emphasizing a principle that goes beyond science. They are highlighting the value of time. Time allows intervention. Time allows adjustment. Time allows the body to respond to healthier habits and appropriate treatment. When CKD is identified early, patients can control blood pressure more carefully, manage blood sugar levels if diabetes is present, reduce salt intake, stay physically active, and follow medical guidance that slows the progression of kidney damage. These actions may seem simple, but their impact can be profound. They can delay complications for years, sometimes decades, preserving quality of life and independence. There is also an important emotional dimension to this condition. Receiving a diagnosis in an advanced stage can feel overwhelming and frightening. It may lead to discussions about dialysis or transplantation, conversations that could have been delayed or softened with earlier awareness. But when knowledge comes sooner rather than later, it transforms fear into focus. Instead of reacting to crisis, you begin responding with discipline. You develop a partnership with your healthcare provider. You track your numbers. You understand your body's signals. You shift from passive assumption to active stewardship of your health. Chronic kidney disease reminds us that prevention is a daily decision. It is not dramatic. It does not require grand gestures. It requires consistency. It requires humility to admit that feeling fine does not always mean being fine. It requires courage to schedule appointments, even when nothing seems wrong. Your future self depends on the actions you take today. And when you begin to respect the quiet work your kidneys perform, you start to appreciate that vigilance is not anxiety, it is wisdom. Silence does not have to become suffering if awareness intervenes early enough.